of eosinophilic esophagitis. Pathological features of eosinophilic esophagitis. Definition: chronic eosinophilic inflammatory condition affecting the esophagus occurs in the absence of secondary causes, characterized by a chronic immune reactions to allergens, leading to a deficient esophageal mucosal barrier. Pathogenesis: recruiting of intraepithelial eosinophils by chemotaxis act as antigen-presenting cells, recruiting T cell, activating mast cell, and activating basophil. Eosinophils secrete a cationic protein eosinophilic peroxidase and major binding protein, causing cell damage leading to the symptoms of esophageal dysmotility. Recruiting T cell differentiated into two helper T cell and secrete interleukin 4-5-13. Activated eosinophils produce transforming growth factor beta that promotes tissue remodeling and leads to fibrosis. Eosinophilic esophagitis is a clinical pathologic diagnosis. Required esophageal biopsies. Biopsies need to be taken from the proximal, mid, and distal esophagus. From 6 to 9 mucosal biopsies give a near 100% of diagnostic sensitivity, while single biopsy gives a sensitivity of 55%. Gross descriptions of eosinophilic esophagitis: present of exudate or white plaques in residual furrows, circular esophageal rings, give appearance of pseudotrachea, esophageal stenosis, mucosal laceration, mucosal edema. Microscopic description: major criterion: more than or equal 15 eosinophils per high power field present in the squamous mucosa. Minor criterion: eosinophils concentration in the surface epithelium, extreme basal cell hyperplasia, eosinophilic macroabscess, eosinophilic degranulation, surface desquamation, lamina propria fibrosis. This biopsy showing extreme basal cell hyperplasia in the squamous epithelium of the esophagus. Surface concentrations of eosinophils. Eosinophilic macroabscess, eosinophilic degranulation. Cases of eosinophilic esophagitis. Histologic features: biopsy A with marked basal cell hyperplasia and increased intraepithelial eosinophils. Biopsy B, dilated intracellular cell spaces with disruption of dijections and eosinophilic macroabscess. C, an esophageal biopsy with a fibrotic lamina and scattered lamina propria eosinophils. After treatment, complete resolutions of histologic abnormalities. Differential diagnosis: gastroesophageal reflux disease. Eosinophils count in gastroesophageal reflux disease are generally higher in distal esophageal biopsies compared with the more proximal biopsies. This is reversed in eosinophilic esophagitis. No surface eosinophilic macroabscess, no lamina propria fibrosis. Eosinophilic gastroenteritis affect any portions of the gastrointestinal tract, with the stomach and small bowel being the most common locations. Symptoms such as diarrhea, intestinal obstruction, and ascites are not common in eosinophilic esophagitis. Summary: eosinophilic esophagitis is a clinical pathologic diagnosis. It represents a chronic immune antigen-mediated disease. Should be diagnosed when there are symptoms of esophageal dysfunctions and at least 15 eosinophils per high power field on esophageal biopsy, and after a comprehensive assessment of non-eosinophilic esophagitis disorders that could contribute to esophageal eosinophilia. Thank you.